Good evening and welcome to the 12 Days of Article and Review. Today is day 10. My name is Mary Coughlin. I'm the president and founder of Caring Essentials, and today's paper is entitled Feeding Intolerance, Inflammation, and Neurobehaviors in Preterm Infants. This is published in the Journal of Neonatal Nursing 2016, and the authors are Tiffany Moore and Rita Pickler. These authors are trying to look and see if there is an association with feeding intolerance and inflammatory markers that may help guide clinical practice and help us better understand this phenomenon in the preterm patient population. They used a retrospective matched case control design, and it was on a secondary analysis of data that was from a previous study by Pickler. The cohort was 114 infants that they were born less than or equal to 32 weeks gestation. And they were basically looking at a possible association between inflammatory markers and specific neurobehaviors with the patients that were diagnosed with feeding intolerance. Now, the framework for this study was by Tiffany Moore, and it was published back in 2014. It was a theoretical model looking at the implications of allostatic load on prematurity and trying to see if there indeed is an association. Basically, what she's proposing is that there is a general stress associated with being premature. And so these individuals have an activated stress response that's kind of, ongoing. And the big question is this chronic state of stress or activation of the HPA axis, is it somehow undermining the physiologic integrity of the premature infant? So she's proposed this model looking at allostatic load, which is basically too much stress. And the stress response, again, there's lots of players when you activate the stress response. Many of these players are inflammatory mediators. And so are they contributing to some of these dysregulatory mechanisms that we're seeing? Now, why feeding intolerance? Well, feeding intolerance could be considered one of the banes of nursing practice in the NICU. Lots of babies manifest feeding disturbances, and of course we're super cautious because of the link of feeding intolerance and medical and or surgical necrotizing enterocolitis. And so it would be really helpful to understand maybe some of the underlying physiology associated with this that may guide clinical practice to manage the stress experience of the infant and hopefully reduce some of these adverse sequelae. So Moore actually did an investigatory work published in 2013, and she did indeed uncover an association between feeding intolerance and stress biomarkers, which warranted further research, prompting this study. So what these guys did is they measured an array of inflammatory mediators, specifically serum cytokines. And the selected cytokines that were analyzed were those that have been associated with neurodevelopmental outcomes in preterm infants. They also then looked at neurobehaviors, and they used the neurobehavioral assessment of the preterm infant tool, which looks at 8 different domains of neurobehaviors, from the scarf sign, motor development, cry quality, behavioral state, and things like that. Again, trying to see, were there other associations with these infants that were diagnosed with feeding intolerance. So out of the original group, the large group of 114 infants, 8 infants exhibited feeding intolerance. And some of the physiologic and demographic information that was obtained around those infants when compared to the larger sample is that they had a significantly lower gestational age at birth, they had a significantly lower birth weight, higher morbidity measured by this neonatal morbidity index, and they also received a smaller percentage of breast milk. And all of these characteristics were statistically significant when compared to the larger sample. So they then compared the cytokine values and the NAPI scores, or the behavioral scores, of the feeding intolerance group to the larger cohort. And needless to say, what they uncovered is that in the infants with feeding intolerance, their cytokine levels, and specifically interleukin-6, were statistically significantly higher than the levels observed in the rest of the group. In addition, their neurobehavioral scores were lower in all of the domains. And so, this is really good information for us, and what it prompts these researchers to do is to really examine and discuss, so what does this really mean? When we're seeing a feeding intolerance, so we're seeing some kind of gut issue, and we're seeing some central associations, central behavioral associations with this. So are some of these findings associated with some kind of disruption in the brain-gut axis? And again, adding to that, should we also be further investigating in immunological functions as well? Because we do know that the gut is the place where a lot of our immune integrity and immune capabilities are managed. And so they kind of conclude that, yes, the results are consistent with the theoretical model that was proposed by Moore, linking allostatic load with complications of prematurity, which basically is suggesting a physiologic dysregulation and an immature nervous system that may be a contributing factor to the feeding intolerance. And so they recommend that further investigation is warranted. And this is really great for us because it really can help guide how we're going to manage feeding intolerance and look at feeding intolerance. So feeding intolerance may be an expression of an overstimulated nervous system. The child is enduring too much stress. And when we look at how we're managing the environment, will we see a decrease in that phenomenon and all of the sequelae associated with it? Of interest, I did some really cool work with a level 3 NICU over in Belgium, and it was all about adopting the core measures for developmentally supportive care into the culture of care. And we worked over about 24 months. And what was really, really interesting is over the time period, that first year, they demonstrated a greater than 50% decrease in the incidence of reflux, another GI manifestation or a GI symptom that may actually also be a manifestation of stress. We know that GI dysfunction and perturbations are associated with stress in the adult patient population. And is it possible, pending further investigation, that this same phenomenon is being experienced and witnessed by clinicians in the newborn intensive care unit as well? And so it's wonderful that these guys are doing the good work and doing the research. I'm sure you can dial into Tiffany Moore and Rita Pickler's ResearchGate and academia websites to see some of the really exciting work that they're doing. And so that's it for this paper. I hope you found it interesting, and I look forward to seeing you guys tomorrow with Day 11's paper. So take care and care well, and check out the written annotation with some bonus links for some other papers that were done by these authors as well. All right, bye-bye.